What's up, everyone, and welcome back to another episode of Health Yes. Here at Cameron County Public Health, where we talk about all things public health and more. Joining me at the table are my colleagues Raquel Castillo and Gustavo Olivares. On today's episode, we welcome Dr. Ron Tyler as we discuss mosquitoes and the vector control process. Thank you for joining us. All right, welcome. Now, let's just go ahead and start off by going around the table and introducing ourselves.
My name is Ron Tyler. I'm the Regional Public Health Veterinarian for the Texas Department of State Health Services.
Raquel Castillo, Lead Epidemiologist for Cameron County Public Health.
Gustavo Olivares, Director for Environmental Health under Public Health.
And I'll be your host, Javier Ch with Cameron County Public Health as well. Welcome to the show.
One of the things that I wanted to talk about was the coordinated efforts between state, county, and municipalities. That was something that we continue to work together to get things accomplished. You know, for the situation with our malaria case in 2023, you know, we came across to find a ways to communicate between cities and the county and the state level to get a goal accomplished. You know, and our goal was to try to work with our municipalities that were affected to see how we could help them and provide them guidance and trainings, and if we needed equipment or anything like that. Working together with our epidemiologist, Mrs. Castillo, you know, to help us work through her side of it. And she might want to talk a little bit about her.
Okay, so basically what our program does is whenever we receive, reports from providers on any notifiable condition, we go ahead and investigate those conditions, those cases, to see if how the people came about getting that illness. In this case, I think since we're talking about mosquito-borne illnesses, we have a person designated to investigate these types of notifiable conditions. When we received, recently we had a malaria case here in our area. There was another case in Texas that was determined to be locally acquired in Cameron County. Mm-hmm. It was not one of our cases, but since it was determined by that jurisdiction that the person had not traveled or had traveled to our area, it was considered to be locally acquired in Cameron County. Mm-hmm. So I don't know if Dr. Tyler can tell us a little bit more about that. What is considered locally acquired? And in this case, how maybe that jurisdiction determined that it was a locally acquired case?
Looking at the case investigations, which Cameron County, the epidemiologist from Cameron County oversaw or gathered all the details, they were looking at a case that was imported just before this case, and there was a individual, I think, that came up from South America, came across the border at the beginning of May, I think May 1st or 2nd, and they had a blood sample that was collected, and they were positive for the malaria parasite, and they specifically had the stage that was infectious to mosquitoes. It's called the gametocyte stage in their blood sample, and Cameron County was working on that case investigation at the time, and they had identified that case. And so that sample was collected around May 5th or May 6th, where they had that blood sample that, had that stage that was infectious to mosquitoes. When a mosquito takes a blood sample and they get infected, it takes about a week, 7 to 10 days for that gametocyte to develop in the mosquito. They call that the extrinsic incubation period. And that individual apparently got bitten by a mosquito here in Cameron County. Somehow this mosquito dodged all the fly swatters in the world, mm-hmm. and was able to bite another individual probably somewhere around May 9th to May 12th or 13th, I would guess. There was an individual that came here around May 8th or May 9th, and they were here right at the same place where that imported case had come across, and so the other person that was here was bitten by a mosquito probably somewhere between May 9th and May 12th, and became infected with the parasite. And then when they returned home, which is out of Cameron County, they went to a hospital, and they got sick and were lethargic, and they went to a hospital. And while they were in the hospital, they took a blood sample from them, and an astute laboratory technician made a blood smear and looked at the blood smear and said, "Whoa, there's parasites on this blood smear." And that's how those two cases are, we suspect, are probably related. And this is not the first time that Cameron County's kind of led the way on unique mosquito-borne diseases. Right. I think whenever I came here, I remember asking, like, what type of zoonotic diseases, what type of, vector-borne diseases, should I be prepared to, look at? And someone said dengue fever, and I was like, dengue fever in America? But like right here, probably the top two Texas experts, they trained me.
Yes, and we don't really see that much dengue in this side. We see numbers from Mexico with dengue cases, but we don't see actual human cases here of dengue. We did have an outbreak back in, I believe it was 2013.
In 2020.
Oh, was it 2020?
Well, we had one in 2020, 2013. About every 6 to 7 years, there will be an outbreak.
Yeah, they'll show up here and there.
Before 2013, it was like, I think it was 2007 or something like that. 2007, 2006. And then before that, 2000, 1999. Like every 6 years.
And that our years of experiences working together as a group, how we start understanding the patterns of how things work, right? For example, like the vector side of it, it just kind of becomes a norm. We already know what to look for the things that we got to see. And I know that every mosquito has to be treated differently, and we got to look at, understand the mosquito that it's carrying these type of diseases, right? Because we have to sometimes encounter either daytime biters or nighttime biters. And in the situation of the malaria case, these mosquitoes, the Anopheles mosquitoes, is more of a active at dark time or later on in the night, understanding those things. But, the team effort between the state and locals and municipalities of years working together has really explained to us the situation, how to work every aspect and different methods. And like for me, learning this time around the malaria case, identifying some resting boxes. I had never heard about resting boxes, right? I mean, you might want to touch about a little bit on those.
Yeah, I remember, it's amazing. My background's not in entomology, so like Gus over here, it's really the strength on that. And when I came here and was learning about the different types of mosquitoes that transmit dengue, and the Aedes aegypti type mosquitoes, which we have a lot of apparently in South Texas, and the types of traps that are used to trap those, and then kind of like the response. I learned a lot about the flight distances, how far the mosquitoes can fly, and whether it's Aedes aegypti mosquito or a Anopheles or what's the Culex or Serophora or whatever the type of mosquito, each one's got a different flight distance. And so.
I know that the information that environmental collects with regards to the type of mosquitoes collected helps us determine what illnesses we will see out there, because not all mosquitoes carry all the illnesses. Right. So if we see a Culex, then we'll start thinking West Nile or something like that. If we see Aedes aegypti, which is, like you mentioned, there's a lot here, then we start thinking dengue, we start thinking Zika, it's like, so that it's information that's very helpful to us.
Yeah, it's really neat to see how it correlates too with the type of diseases that get seen. Like if you see, you look at like West Nile, tends to be more prevalent up in the coastal Bend area and up in, if we're Region 11, but if you look at the state, it's even more prevalent up in the Panhandle and the North Texas, and that's the Culex species. And you look at the mosquito data, the types of mosquitoes that are being caught, how prevalent those mosquitoes are, how much more prevalent they are compared to, when you start looking at the Aedes aegypti mosquitoes and you looked at South Texas, you're like, whoa, they have over 50% of all their mosquitoes caught are Aedes aegypti.
In understanding the component of differences, right, between different type of mosquitoes and diseases, and for us, it's the learning tool every time that we deal with this, because it's just a refresher. But it is sometimes confusing because it is almost some of the similar things. For example, like on the, the type of breeding sites, right, and also determining what trapping works well for this type of mosquito, what's trapping for the other. Like I was mentioning earlier about the resting box. I had never heard about a resting box. And it's something new that was brought to the table. It actually hasn't even been manufactured. Something that someone built together in the garage, and it was able to help us try to put this together. So to try to trap these type of mosquitoes, or the CDC light traps with dry ice or no ice, or, it's just it's something that we are working together to train and educate everyone as much as possible in regards to the different types of mosquitoes we deal with on a daily basis.
It's amazing how many people are involved when we identify something unique like this. We have expertise, from the laboratory staff that are experts at testing for malaria or plasmodium parasites and identifying them. So there's a collection of laboratory staff, and then the zoonosis control branch in Austin had staff that went out and got into their wood shop garage and started making unique special traps to try to increase our Anopheles mosquito catches at our local jurisdictions. And then so many different folks up in central office, and then coming down to the region that we had regional staff that are trying to put together documents and assimilate all the materials and try to coordinate, keep everything streamlined and identify where we're going to make our targets at. And then, all the local health department and the local jurisdiction vector control staff that go out and place the traps and spray in the area is so neat to work with all those folks.
Yeah, it's an understanding also are the needs of every municipality, right? Because every municipality is different. Mm-hmm. Everyone functions different. And most importantly is knowing what are the needs, what is it that they need? Sometimes it can be equipment, sometimes it can be, machines or even at one point, even licensed staff to do their spraying, and how important it is to have the right people in place, not just within our programs, but also with other jurisdictions that could come and help, because I believe vector control and our component is one of the need departments that is eventually very helpful to be able to control possibility of an outbreak of vector control mosquito disease, and with the team of our EPIs here at the county would also, help us understand what exactly does every disease that we have, that it gives us more information, but working together.
Yeah, it's definitely teamwork. Takes
Yeah.
teamwork to
Teamwork
get things done.
makes the dream work.
Yes.
Absolutely. Man, it's interesting to hear because, a lot of people think, mosquito is a mosquito, but you don't realize the different types of mosquitoes that are out there and the different conditions that correlate with each one, what viruses or diseases are carried between each one, and how they're transmitted as well. I know not all mosquito-borne diseases are carried. You think, oh, it's a disease. This person's infected. I'm going to get it through them. It's like, no. From what I recently learned, that malaria is only transmitted through the mosquito itself, not the actual, not the person that's been infected. Maybe we can talk a little bit about what are some of the differences between some of these mosquitoes and how, I guess, some of these diseases are transmitted, and some of these conditions that some of these conditions that maybe we can share with the public that can decrease mosquito bites possibly, and what to look out for as well?
I would say, like in our part, it's just educating the public to understand the differences, right? So, for example, we're dealing with Aedes aegypti mosquitoes. It's more time sometimes daytime biter, but also at nighttime, right? But understanding that and finding a way to try to stay indoors at the proper times, right? And if you're going to be outdoors, what is it that you're supposed to wear? What type of clothing should you wear right now? It's understanding where they're bred, right? So our Aedes aegypti, a lot of them are bred in artificial containers, right? So the public to understand that, hey, source reduction on their part is very important, because that would help us combat any of these issues. And a lot of these mosquitoes sometimes are actually in the habitats of regular homes. Understanding that, make sure that you have proper screenings. Make sure you have you close your doors every time you go in and out. Wear proper repellent or clothing.
Yeah, all the biology or the ecology of the mosquito, I think, really plays important roles. The disease transmission from mosquito to human is, important, but it's also really interesting how the dynamics of the pathogen within the mosquito population is different. So like West Nile virus or St. Louis encephalitis virus, we have what we call amplifying hosts. And an amplifying host typically are the birds, some type of bird population. And so they serve as reservoirs plus amplifying. The birds get infected and they'll produce a high viremia or high viral load in their blood. And so then whenever mosquitoes go and bite the birds, they can pick up if they don't have the virus, they can pick it up that way. Then the other thing is the horizontal versus vertical transmission within the mosquito. So like horizontal transmission, or vertical transmission goes from the mother mosquito to all of its eggs that the mother lays. So that's the vertical transmission, sometimes called transovarian transmission, goes into the eggs. So all the babies that are born are naturally infected with the virus. The lifespan of that mosquito is probably around 30 to 45 days. And then it's got to, it picks the virus up somewhere, or maybe it's born with it. So the St. Louis encephalitis and the West Nile virus had the vertical transmission. Malaria doesn't have vertical transmission. So the only way a malaria mosquito picks it up is by biting a human, and the humans are the only reservoirs for the malaria parasite. There's no wildlife reservoir, so it's got to bite a human that's got that specific stage, that gametocyte stage. So those are all the barriers that kind of get placed in front of malaria transmission.
Yeah, and understanding the disease itself, right, and the mosquito itself, because I sometimes people think that, since we've been dealing with other things in this world, that sometimes something like this can be just transmitted between person to person. And in this situation, malaria is not that case. You need that mosquito to help transmit these things. And sometimes just educating our public about that component, because sometimes they believe that it could be transmitted just person to person, and that's not the case.
That's correct. And that's why this team also includes the community, because they have to do their part also. And source reduction, like you said, that's a big thing. Yes.
So basically, vector control in our community is just to provide awareness to everyone in regards to mosquito control. But having the proper equipment, like I mentioned earlier, is something that Cameron County here has in place to help every single municipality, every county that we need, even at the state level. The resources that we have here in place are to help anyone in need in our communities. But more importantly, vector control is everyone's got to do their part.
Right.
From the regular public to us, to at the state level, and to all the way to CDC. And we've had the pleasure to work together from the local person at home to all the way to the top of the CDC level. And the point across that is just to educate our public, make them aware of what is transpiring. I always say this, that no matter how many times our county vehicles pass through a neighborhood and do adulticiding and larviciding any standing water within our reachable methods, is important, but the biggest piece is for the public to do the source reduction themselves.
For us, it's basically educating the public on reporting, on if they are sick, if they have any symptoms, fever, muscle aches, headache, vomiting, to go to their provider. If they've traveled, to mention that to the provider so that they can go ahead and do the necessary testing. And should they be diagnosed with malaria or any other mosquito-borne disease, it can be reported to the local health department so that we can proceed with investigation and take any necessary actions to prevent any more spread.
And what's more or less the process when it comes to reporting a mosquito bite or what have you?
So once they get tested and come out positive, the provider will report it to us, to the county, and we'll go ahead and initiate by our investigation by requesting medical records, basically. And we'll review the case, determine that if it meets criteria, which is something set by the state. And if it does, then we go ahead and we interview the patient also. And any necessary steps that they need to take, we'll go ahead and do that, and then work with our environmental health program and with the municipalities too, in case that person lives inside city limits.
Dr. Tyler, is there anything else you want to add?
Yeah, I want to talk about mosquito surveillance.
Absolutely.
I don't know how we didn't talk about routine mosquito. We were talking about like this malaria, rare incident, but every year Cameron County, local jurisdictions do routine mosquito surveillance. I was just thinking about this. Probably a lot of people don't know how much work gets done behind the scenes, kind of per se, whether or not we detect a positive human or, a disease in a human and all the additional stuff that might go on around that case. But they're just the regular general public health kind of boots on the ground, annual surveillance activities that go on. I remember, anytime there's a mosquito that tests positive, we get notified about the mosquito, and then I call up Gus and say, hey, or I send an email to, and I remember a couple of years ago, we don't see a lot of positive viruses, but I called Gus up and I was like, hey, Gus, we have a positive. And before I even said where it was, he knew exactly where it was. I was like, how does he know this? And he hadn't seen the report yet. I know he didn't. He just knew where it was going to be because they have that, insight. But so local jurisdictions do mosquito surveillance every year, and the state will take, the state has a entomology lab that jurisdictions can send mosquito samples, and city or county jurisdictions can send mosquito samples too, and they'll identify the type of mosquito, and then they'll crush the mosquitoes up and test them for different pathogens, and then if they test positive, then they'll send the report out to me, and then I get a call and say, hey, guess what?
Yeah, let's work on it. And that a couple of years back, and when we started this program with Doc, I don't remember if you remember the monthly program, Doc, when we started it.
I think it was, I'm thinking it was 2016. To me, I hear 2016, I think 2 years ago.
Yeah, no, but it's been some time. So we were approached and said, hey, let's try to do a roundup, right? Once a month, certain times of the year, certain months out of the year. And I thought it was a great idea because there's, like we mentioned earlier, there's some cities that don't have the program to trap every other week or so, or every week. And so doing this mosquito roundup, we give them one day out of the month, and they all set up a trap right before. And then whatever they catch or trap, they bring it to us, and we're one of the depots, right, that we receive anywhere within Cameron County, brings it to us, and then we work with Dr. Tyler and his staff to ship them up to Austin. And the importance of doing this is because now you realize what type of mosquitoes you're dealing with in your community and within Cameron and then throughout the state. So it's such a beautiful thing to see some of the reports that come back sometimes from the state level, showing the type of mosquitoes that we have in our area, but it comes down because of those collections that we were able to collect the mosquito and they were able to identify it, and then also the disease side of it. I mean, if there's a positive mosquito, that's where Ms. Castillo gets involved and her staff to network with those clients, and I don't know if you want to touch more about that, Ms. Castillo.
Yeah, so if we are informed of a positive mosquito, then we look to see if we've had any cases in that area. If not, basically we do education.
Gotcha.
For that area.
Yeah, and the reverse, if you're where identify a positive human, this is not the routine mosquito surveillance. This is I had Gus print out a map of some of the places where we did enhanced mosquito surveillance, and that type of enhanced mosquito surveillance is usually targeting the specific mosquito that's associated with that disease and that flight path, distance, how far the mosquito's likely to fly, and then we're basically kind of and there's vector control activities that go on in that area. The
enhancement of having a positive person case, it just goes to a different level in our end. I mean, we start from trapping to spraying every day, and track the case. How far are these? Where did the case transpire? So we can determine how far we're going to treat, either a quarter of a mile, half a mile. What is it? Or blocks or subdivisions, depending on the area. But the enhancement on this, when we do have a positive case on the human, it's all hands on from everyone at the local level to all the way to the state level, including CDC. So it's just a network that we've gotten to put a big role in it, and learned it also throughout the process.
Wow. And the surveillance and the mosquitoes that were caught and stuff, like going back to the Aedes aegypti, we do have a lot of Aedes aegypti. Right. And if you look at all of our mosquitoes caught, they represent like over 50% of our mosquitoes in this, in Cameron County. But then Anopheles, you look at it,
it's not easy to catch.
It's not easy, like less than 3% of all the population are Anopheles, and we're struggling. And each time the local jurisdictions would go out and catch mosquitoes, they would set aside the Anopheles mosquitoes, and those mosquitoes got sent to Atlanta, Georgia, specifically to the CDC malaria lab, where they were tested. And I'm trying to remember how many, like 5 or 6, maybe 7 total batches of mosquitoes got sent out, and I think collectively maybe less than 150 total mosquitoes. That's how.
Right, and we were thinking like we're going to be seeing big numbers, right?
Thousands,
and we're like, we're doing something wrong, because normally when we have those peak numbers of mosquitoes and we're dealing with the Aedes aegypti, bred in artificial containers, it's like you set up a trap and you're talking about a couple of hundred sometimes, right? And then when you set this up, it's like, hey, wait a minute, there's something wrong. But then talking to CDC at the state level and our local level, it's like, no, if you catch 2 or 3, man, it's something that we need to be sure that it's something important, because the risk here in our area is a low risk. Right?
Yep, 2 or 3 mosquitoes from maybe a collection of like 200 mosquitoes. 3 of them would be this Anopheles mosquitoes, and those were those rare ones that got set aside. That's how. Wow. Yeah, there's very few.
My goodness, who'd have thought?
Yeah, exactly.
The ratio that was so
3 out of 100 mosquitoes caught is Anopheles. It's such a rare.
Yeah, and for us, that explains why we haven't had any more cases.
Right.
So we don't see.
I feel like we've covered quite a bit. I find it so interesting listening to y'all talk about the importance of the vector control process not just in the public health system, but also the roles played by our staff in environmental health, our epidemiologists, and of course, how it ties back to experts like yourself, Dr. Tyler. And I hope our listeners learn something from this, but not only that, I also hope that they also do their part in helping with the vector control. And I think this is probably a good place to end on here. I'd like to thank our guests, Dr. Tyler, and my colleagues, Raquel Castillo, Gustavo Olivares, for sharing your information, your experiences, and sharing your time with us.
Thanks so much.
Thank you. We enjoyed it. Thank you.
As always, I'd like to thank everyone for joining us. To all of our listeners, make sure to follow us at CCPH Texas on all of our social media platforms. And remember, stay safe, stay healthy, but more importantly, stay informed. We'll see you on the next one. Bye-bye.